Hi, my name is Stephanie with the Dental Implant Center of Oklahoma. I just wanted to show you really quickly how to properly care for your all-on-four zirconia or acrylic prosthesis after they've been placed, after your surgery. So typically for the first 2 weeks following surgery, we don't really want you touching the tissue just because you've got to heal. We can't risk anything, damaging the tissue while it's so fragile following surgery. So for the first 2 weeks, we're going to have you rinse with a chlorhexidine gluconate, a mouth rinse that is medicated and helps kill and control some of those bacteria in your mouth. We're going to have you do that twice a day. Following that 2 weeks after surgery, we're going to have you come in and we're going to take your teeth off. We're going to remove your sutures and we're going to show you how to properly care for your fixed prosthesis. So there are a couple of things that we're going to show you how to do, and we're going to send you home with a water pick and some super floss and some proxy brushes. I'm going to show you all of those things really quick. Okay, so this is a stone model and it's got some zirconia teeth on them. I took the gum tissue off, so this is going to be a bigger gap than what you're going to have in your mouth. But for the sake of just showing you how these things work, this is what we're going to use. The first thing I want to show you is called a proxy brush, and it just reminds me of a pipe cleaner. And these are cool because they come in different diameters, so they can be super tiny or they can be bigger, just depending on what you need in your mouth. But you can bend these so they can go wherever you need them to go. So what you're going to try to do is locate your first implant and just go between the gums and the teeth and try to brush that just like this as well as you can. And you're going to do that around all of your implants, just like this. Okay, that's just going to help mechanically remove any plaque or debris that might be there. The second thing is called super floss, and it's got a stiffer end just like this that you will be able to thread, kind of like sewing, right between your implants like this. You just push it through and pull, and then you'll be able to floss, clean the front implant, and then push it back towards the back implant like this and clean that one just like that. And you'll want to go through wherever there are two implants. You'll want to go through here, and then you'll go through this gap here between implants, and the same thing on the other side, here and here. The last thing is going to be a water pick like this. This one is like a travel type water pick. There's a reservoir for water, and then there are different tips that come with it. Just find the one that's most comfortable for you, and then there are different settings. Obviously this sprays water, so it's going to make a little bit of a mess. Just be in the bathroom when you use it. So what you're going to do with this is you're going to turn it on, and then you're going to go right between the gums and the teeth. And like I said, this is a bigger gap than what will be in your mouth, but to show you, you'll want to go right in here between those implants, kind of where we put that floss, and you'll want to spray out any food debris or bacteria that might be in there, just like this. But those are the three main ways. Besides, I want you to go ahead and use a toothbrush and brush the teeth as well. But those are the three things you'll use to clean under the prosthesis. Sometimes people may not realize how big of a deal it is to actually get under and clean the prosthesis, and it's really, the before and after is just incredible. We don't clean well, like in this picture, the tissue is very inflamed, it's red, it's pretty angry, you can just see. And then we went over OHI again, the oral health instruction, how to clean properly under the prosthesis, and then 3 weeks later, this is what it looks like. It looks so much better. We had to take our sutures out, of course, because what we ended up having to do in this situation is clean out that necrotic tissue and suture it back together. And then once that healed and she's been cleaning under it how we showed her initially, she just didn't realize how important it was. And once we showed her what it looked like in these pictures, she was much more diligent, and it just took 3 weeks for it to look this much better, this much more healthy. Having this procedure done can be life-changing, it can be life-altering. So we want you to live your life to the fullest and be able to enjoy these implants and these solid teeth for as long as you can. So part of that is keeping your teeth healthy, your gums healthy around your implants, and following this regimen of cleaning under your prosthesis will help the longevity of the prosthesis and your implants. Obviously, professional care we recommend. We work with multiple dentists that you can go see for your regular hygiene care, and they will be able to help you on a professional level if you need a little extra help. But at home, every day, twice a day, cleaning under your prosthesis the way that we've taught you will pay off. In the long run, you could see how healthy her tissue was. So obviously, if you ever have questions or you need us to show you again how to clean under your prosthesis, we're more than happy to do that.